Scoliosis is the most common type of spine deformity, identified very commonly among the young kids and adolescents, and the main features is the side deviation of the spine with some rotation of the vertebrae. The scoliosis can be identified in young kids, especially adolescents, which you note this deviation to one side or another, and asymmetry of the body parts like the shoulders, breast, hips, and similar. Most of the time we don't know the cause of scoliosis, but there is a very strong genetic trend, and more than 80% of those cases is called idiopathic scoliosis, which is there is no known cause for that spinal deformity. Like any spinal deformity, usually we cannot prevent it because usually there is a genetic trend. However, we can detect it much earlier with the proper screening and then make the treatment much more appropriate and easier to treat. For whoever has scoliosis, it's very important to detect in the early phase because all the treatment is easier, and scoliosis is important to detect in the early phase. So when detect, you classify as mild, which requires only follow-up and physiotherapy, moderate level of curvature, which requires physiotherapy and sometimes brace when the kid is still growing. That's one importance of the early detection, because there is a specific phase in which the brace can work. If you detect scoliosis too late, the brace is not useful anymore, for example. And for advanced cases like severe curves, it requires a surgical procedure for the treatment and correction of the spinal curvature. So according to the level of the scoliosis, majority of those cases, the patient has a pretty much normal life, but those moderate and severe deformity requires additional treatment. So there are some restrictions after the treatment according to which kind of treatment. But most of the time, the treatment is successful, especially, as I said, if you detect in the early phase. King's College will provide one school screening program in order to detect the scoliosis in the early phase, going to the schools, actively search for kids who have this potential deformity. So the idea of this project is kind of pioneer in the region. However, it is being done for several years in different countries. It is not common to be done yet. In this aspect, it will be very important to detect the scoliosis in the early phase by our team of doctors, nurses, and the physiotherapists from King's specialized in training for this detection. So our team of experts will check the kids in the school, and then after those cases which are selected as potential cases of spinal deformity, cases will be referred to the specialized center for confirmation with additional image and for the treatment according to the case. As part of the team, we are organizing this school screening program. We strongly motivated the parents and the kids to participate of this screening. It's completely harmless with just observation of the spine from the back view and side view, and those cases which we suspect of some spinal problem, we will refer to the specialized center for confirmation and for the treatment for those cases which are required.